One of the things that community hospitals have the ability to do is to adopt new technologies and new ways of doing things fairly quickly. We have to be constantly innovating. We have to constantly be looking at doing things different because there's not more help all along the way. And we know that those cost constraints are going to continue to press on us. So we really have to identify, how do we decrease the cost of care? How can we be effective in making sure that there is a balance of that quality and that service over cost? And I think technology is the gateway to be able to create that type of access for anybody. When we think about remote patient monitoring, it's also understanding our communities. We had a woman that we sent home with a digital scale, and we noticed that she was gaining almost 4 to 6 pounds a day. So by that second day, that nurse said, we need to call and find out what was going on. So they called and had that conversation. She said, yes, my legs are starting to swell up. So the nurse talked to the nurse practitioner who adjusted her medication dosage, and we avoided not only an office visit, but more importantly, kept that woman out of the emergency room, and she was able to manage her health at home. And so when we look at leveraging that type of technology, we have to really look at, how do we get that into the end user's hands, and how do we practice healthcare outside of our doors? And I think that's the opportunity that Expanse has, was getting into a lot of the greenfield space, is allowing us to do that. And I think it's not just about innovation. I like the terms being imaginative and being inventive about what we're going to do tomorrow.